Hello and welcome to the Norton Talks Mental Health series with me, Alina.
Okay, so last week our mini episode was all about what is depression. And this week we are continuing to talk about depression, but focusing on the different diagnoses. Now there are lots and lots of different diagnoses which we cover in our training courses. So that's our mental health first aid course and our mental health awareness course. So please do get in touch to find out more. But for today's session, we are specifically going to talk about prenatal and postnatal depression. And now I think it's more important than ever to be discussing these diagnoses because of COVID-19. And lots of women who are currently pregnant or may have just given birth could be finding it even more difficult due to all the restrictions that are currently in place. Okay, so what is prenatal or postnatal depression? Now, these two diagnoses are about having depressive symptoms. So all those symptoms we talked about last week. And you're feeling this way maybe before, during and after pregnancy. Now, postnatal or postpartum depression affects more than 1 in 10 women. But sometimes it can affect their partners too. Sometimes women do feel a little down, a little tearful and overwhelmed during pregnancy and after they've given birth because of all the changes that are physically and mentally happening to their bodies. You know, their hormones are increasing, they're decreasing, and they could, or most likely, are also experiencing sleep deprivation. However, if these feelings, this low mood, sadness, anxiety, they're not getting better and they're persistent, and maybe even when the baby's born there are some difficulties bonding, it could mean support is needed. Now, sometimes it's difficult to recognise how we are feeling in ourselves because it can be a gradual change, and we do kind of accept it's going to feel, we are going to feel different, we are pregnant or we've just given birth. And so this is where our support networks need to be really, really mindful and ensure they're being supportive. And I think the best way to be supportive is by actually asking the individual what they need, okay? Because our interpretation of what they need could actually cause more stress than support. So it's important to ask. And if you are extremely worried about that woman, it's important you are guiding her to seek professional support. Or if you feel that she may be in a crisis point, you're seeking it on her behalf. Now, prenatal and postnatal depression has no trigger. However, if an individual previously has struggled with their mental health, especially depression, it could have an impact on them. In a similar way, there could also be a genetic link that we do need to kind of be aware of. But I think the key to remember, if you are feeling this way, you are not alone in any of these situations. There is lots and lots of support available. And it's okay to ask for help. Asking for help will make you feel stronger and feel more in control. Okay? Well, that's it for me today. If you do find yourself feeling this way or you're noticing these changes in someone you know, we have shared some information for where you can find immediate support. Next week, we are talking about support in much, much more detail. But for now, take care and stay safe. Bye.